My name is Victoria Criolla. This is for our community health preceptorship program that we're doing. And the topic tonight is the importance of smoking cessation. Smoking causes more than 480,000 deaths in the U.S. each year. 1 in 5 deaths in the U.S. is caused by smoking, and 80% of all COPD cases is caused by smoking. More than 10 times as many citizens have died of cigarette smoking than they have in all the wars put together that the U.S. has been involved in. Smoking causes about 90% of all lung cancer, is the predominant cause of lung cancer. More women die from lung cancer each year than they do from breast cancer, and with breast cancer statistics on the rise, that says a lot. About 80% of all deaths from COPD, chronic obstructive pulmonary disease, are related to smoking. Cigarette smoking increases the risk for death of all causes in men and in women, and the rate for women is higher by 0.7% than it is in men. The risk of dying from cigarette smoke has increased over the last 50 years, and that's because of the rise in advertising, the ability to watch advertising on the internet, have access to cigarettes, have access to a lot of products that contain tobacco and nicotine. Smokers are more likely than non-smokers to develop heart disease, stroke, and lung cancer. For coronary heart disease, you're 2 to 4 times more likely. Men developing lung cancer by 25 times, and women developing lung cancer by 25.7 times. Lung tissue is hard and necrotic in the smoker's lungs, and you can see that the heart is enlarged. It has trouble getting oxygenation, therefore the color changes, the walls thicken, and the heart can no longer pump blood through the body. This is a healthy set of lungs and a healthy heart. You can see the difference. Lung disease caused by smoking includes COPD, emphysema, chronic bronchitis. Causes most of the common lung cancers that we know of. If you have asthma, it's more likely to trigger acute adult asthma. Acute adult asthma does more damage to the lungs than chronic obstructive asthma does. Smokers are 12 to 13 times more likely to die from COPD than non-smokers. Cardiovascular risks. Many people don't understand what happens to the cardiovascular system when you're a smoker. You have increased chance for stroke, increased chance for atherosclerosis and blood vessel damage. Also an increased chance of kidney disease because of the damage to the arteries that carry the blood from the heart to the major organs. Smoking causes stroke, coronary heart disease, the leading cause of death in the United States. Again, it causes coronary disease, which is the leading cause of death in the United States. Even people who smoke fewer than 5 cigarettes a day are affected by this. Smoking damages blood vessels. It makes them hard. It makes them rigid, and it makes them unable to carry blood vessels. It causes chronic hypertension, which also damages the vascular system. Heart attack occurs when a clot blocks the blood flow to the heart. Stroke occurs when a clot blocks the blood flow to the brain. Your incidence rises with each cigarette that you smoke. Cancers. Everybody's familiar with lung cancer. They think that that's what smokers get. Smokers get a lot of different cancers. This is an example of oral cancer or mouth cancer. This is in a cancerous spot on the heart. A lot of people don't understand that smoking affects cancer in every single part of the body. Bladder cancer, blood cancer, cervical cancer, colon-rectum cancer, esophageal cancer, kidney and ureter cancer, larynx, liver, oropharynx, pancreas, stomach, trachea. If nobody smoked, we'd have a drastic reduction in these cancers. You need to quit. Quitting cuts cardiovascular risks. Just 1 year after quitting smoking, your risk for heart attack drops sharply. Within 2 to 5 years of quitting, your risk for stroke fall to about the same as a non-smoker's risk. If you quit smoking, your risk for cancer of the mouth, throat, esophagus, and bladder drop by half within just the first 5 years of quitting smoking. Drop by half within just the first 5 years of quitting smoking. 10 years after, your chances of lung cancer drop. You're going to want to think about committing to a quit date. True or false? Smoking causes more deaths per year than the following combined: HIV, illegal drug use, alcohol use, motor vehicle injuries, firearm-related incidents. True or false? More than 10 times as many U.S. citizens have died prematurely from cigarette smoking than have died in all the wars fought by the U.S. during its history. Smokers are more likely than non-smokers to develop heart disease, stroke, and lung cancer. Smokers are at greater risk for diseases that affect the heart and blood vessels. And if nobody smoked, 1 out of every 3 cancer deaths in the United States would not happen. All true. The addiction. The addiction is the part that's the issue. Once you start smoking, nicotine is highly addictive. It is more addictive than those rates of cocaine, heroin, and alcohol. It is more addictive than cocaine, heroin, and alcohol. Nicotine addiction affects 1 in 3. Statistic drug ratios show that it's about 1 in 5 for the heavy use drugs. 1 in 3. Nicotine is binding to the acetylcholine receptors in the brain, which changes your brain function, also changes the way your body responds to acetylcholine. Nicotine acts on the areas that regulate vigilance, arousal, concentration, stress reactions. They cause the smoker to be more alert. They can cause the smoker to feel more energized, to feel like they're running at a higher capacity. This is what a lot of people miss when they go to quit. 1 year after quitting smoking, your wrist drop. This is what happens to the body when you quit. Within 2 to 5 years, your risk for stroke falls, just as we've talked about before. Your risk for cancers drop within 5 years. 10 years after you quit smoking, your lungs get healthier. The cilia in your lungs that you kill off with every puff of smoke that goes into your lungs begin to regenerate. And they're able to move the gunk out of your lungs so that you can breathe more easily. Withdrawal. Withdrawal is the big issue for a lot of people who smoke, the reason why they don't want to quit. Withdrawal comes with nicotine cravings, anger, frustration, irritability, anxiety, depression, and weight gain. Cravings. To curb those cravings, there are patches, gums, nasal sprays, inhalers, and lozenges. Cravings can be curbed by healthy snacks, such as carrot sticks and celery. Not as enjoyable psychologically, but it does get the job done for the oral fixation. The power of positive thinking. Power of positive thinking does work. If you can imagine yourself smoke-free, dealing with a stressful situation, then you can quit. Prescription medications such as Chantix are also available to reduce cravings and help you quit. Remind yourself that the feelings of anxiety, anger, frustration, and irritability are only temporary. Engage in physical activities such as taking a walk. Make a phone call. Talk to a friend. Limit your caffeine. Caffeine intake, because caffeine is another addictive substance, can increase cravings. Try meditation or relaxation techniques. You can try massage, hot baths, breathing deeply. Ask your doctor about medications that can help with these symptoms as well. Call a friend, have lunch, go to a movie. Include activities where you can't smoke, that are in non-smoking venues, so that you won't be tempted to light a cigarette. Identify specific feelings about what is making you angry, frustrated, upset, or depressed. Once you identify these feelings, you can identify positive ways of dealing with these feelings versus lighting up a cigarette. Increase physical activity. Physical activity deals with depression because physical activity can cause a release of endorphins from the brain, the same endorphins that you feel released when you're smoking. Make a list of things that are upsetting you and write down solutions for them. The power of positive thinking. See your doctor for medications that can help with depression as well. For weight gain, this is a big factor for a lot of people who don't want to quit smoking because they're scared of weight gain, especially women. Sugar-free gums, sugar-free hard candies, celery and carrot sticks, like I said, they're a great calming for the oral fixation. Sliced sweet peppers, vegetables, power of positive thinking. Power of positive thinking, you can do it. You can replace these cravings. You can make one of these substances give you just as much pleasure as a cigarette if you believe you can. Prescription medications can also help with this. And increasing physical exercise, again, you need that endorphin rush. You need that blood pumping through your veins. When you smoke a cigarette, it's a vasodilator, so you get that rush of blood that goes more towards the organs and makes you feel energized and alive. You're replacing that by using physical activity, which is a healthy alternative. Identify your triggers. Triggers are important for dealing with cravings. Triggers are stress, depression, Talking on the phone. Have you ever done something so inane that you do 1,000 times a day and you never realized the things that you do while you're doing it? If you're an overeater, maybe you're talking on the phone or watching TV and you're just chomping on the chips. Not even hungry, just chomping on the chips. When you're a smoker and you're talking on the phone, you're drinking alcohol, visiting with friends, just watching TV, you're smoking the cigarettes. Just like the overeater who's chomping on the chips, you're smoking the cigarettes. When you finish a meal, this is a time when most smokers find the need is most intense. Once you've had a meal, to top it off, the pleasurable act of having that meal, just like having sex, you want to smoke. You find ways to deal with that. Drinking coffee, again, because coffee is another stimulant, contains caffeine, it increases your desire to smoke. Increasing physical exercise safely. This is important because smokers do a lot of damage to their bodies. There's a lot of damage to the lungs. There's a lot of damage to the heart. So increasing your physical exercise, you can't go out tomorrow and run 3 miles if you haven't, walked 10 minutes a day in years and you're a smoker. You must increase it safely. You must always meet with a physician, develop an exercise routine, develop a plan. Smoking damages all of your internal organs, so make sure that you get a thorough physical and any medications that you need to manage issues such as high blood pressure. That can be an issue when you're working out. Know your limits and manage your breathing. Breathing exercises work very well for people who are considering quitting smoking. They also work well for people who are trying to increase their lung capacity due to COPD or asthma. Take a break. When you need to manage your stress, instead of walking out and having a cigarette, take a break, take a walk, take a deep breath. You want to do this in place of feeling that psychological need of having that cigarette in your hand. It's also a physical need. So take a walk, get some physical exercise, play a game, have a snack, a healthy snack. Breathe deeply, slow your breathing down. Do focused, controlled, concentrated breathing techniques. There's a technique where you breathe in through your nose, it's called smell the flower, and blow out the candle. You breathe deeply in through your nose and out through your mouth. It works. Not only does it help with managing stress, it helps calm depression, anxiety, and irritability. Visualize, close your eyes, the power of positive thinking. Visualize yourself calming down. Visualize what the real stressor is, what is really making you upset, and how you can find alternative solutions to that, instead of just trying to put it in a bottle and put a cap on it by having a cigarette. Finding solutions for it is a better long-term idea than damaging your body. Talk to somebody. Friends and family members, everybody in this room knows somebody who smokes. Everybody in this room knows somebody who has quit smoking. Everybody in this room knows somebody who has had an addiction. Talking these things out can really improve your ability to have success on a cessation program. Focus on the here and now. A lot of people worry about what if in the future. Well, what if tomorrow something happens and I get really upset and I have to light up a cigarette? Well, what if tomorrow something, you don't want to do that. You want to focus on the now, the right now, the here and now. You want to say, this is the problem I have in front of me. This is how I'm going to deal with it. And it doesn't include lighting up a cigarette or putting chewing tobacco in your mouth or a cigar or a pipe. Take care of yourself. Eat right. Improve your diet. Do the things that you need to do to lower your blood pressure if you have coinciding comorbidities. Do the things that you need to do to increase your physical exercise to get healthy. You want to eat a balanced diet. You want to drink lots of water. And you want to get enough sleep. Cut out the caffeine. Cut out the caffeine. This is probably about the 4th time you've heard me say caffeine is bad when you're trying to smoke. Caffeine messes with some of the same receptors as smoking does. So caffeine triggers a desire for you to smoke. Face the problems at hand. Again, this is probably the 3rd or 4th time you've heard me say, be in the now. Face your problems now. Understand what's making you want that cigarette and the stress management coping skills to avoid those things. That is my presentation on smoking cessation. I have a small little questionnaire for you to fill out now that we've completed.